In Alberta hospitals, some physicians say the situation is so dire, the province needs to declare a state of emergency.
It's gotten to a crisis state where patients are dying in our waiting rooms and patients are having very bad outcomes because of how unsafe it is.
It's exactly what you would see from a war zone hospital.
It's a situation Dr. Warren Thirsk knows all too well.
It's carnage. It's daily carnage. The overload of human misery is tough to witness.
The emergency physician says what he sees now is the worst in his 25-year career. He blames a growing and aging population and not enough room in hospitals, and says patients are the ones who suffer.
When there's no health care available for you because the beds are full, because the operating rooms are full, because there's no nurses, because there's no doctors, because there's no budget, then you're waiting.
The call comes mere weeks after a 44-year-old man died in an Edmonton emergency department after allegedly waiting 8 hours to see a doctor. The Alberta government has invoked a state of emergency before, during the COVID pandemic.
It can enable expedited funding, emergency staffing measures, rapid redeployment of beds and equipment across hospitals.
But it does not create hospital beds or more staffing, this expert says.
But it's not going to address those long-term, deeply rooted structural problems that we're seeing in the healthcare system.
Alberta's Ministry of Primary and Preventative Health Services tells CBC News the system is using all available resources. Calls for a public health state of emergency are misguided and would add nothing to what is already being done. The province's hospital ministry also points to plans for 1,000 new hospital beds and says it's also coordinating resources on the local, regional, and provincial level to make sure they go where needed. Julia Wong, CBC News, Edmonton.